We're going to see the generalities of the veins in a AVM or arteriovenous malformation, usually for the brain. So we have the distinguished feature of a vein versus a artery normally is the color, but in a AVM we say that the vein has been arterialized, so it is engorged and dilated. So the color is not a good feature for distinguish between them. Rather than color, so instead of color, we would use the size of the vessel, because arteries have a big layer of muscle cells and the elastic tissue, as opposed to the veins. The artery is difficult to be dilated unlimited. So usually if we have a vessel that is greater than, let's say, 4 millimeters, we would say it is a vein. So it would be a vein until proven otherwise. Also that the artery has this big layer of muscle cells makes them better to be coagulated. This we will see it on the arterial part of the AVM in other video. There is something in the vein that aid in the importance of this. It is that the most important thing in a AVM is not to damage or transect the vein, because if you here you have the AVM, this is, let's say, the venous drainage, this is the nidus of the AVM, and here is the input from arteries. If there is only one vein and we transect the vein, we are increasing proximally the pressure and produces a rupture of the AVM. So the most important thing in a AVM resection is not to cut the vein. If we have secondary veins, maybe we can sacrifice them, but not if we have just one, or we cannot sacrifice the primary vein. That is the most important issue. So we could not transect a vessel unless we are 100% sure it is not a vein or the primary vein. Something that can aid in the distinction between vein and artery is, for example, when we put a embolic agent, the artery will change of color, will be more obscure, as opposed to a vein. The vein will stay in that color. In contrast, if we occlude a vessel, if it is a vein, it will be obscure, and the artery will stay the same color. In the microscope, it can help a little bit, because the microscope makes easy to see the striations of the artery, and so we will see the artery as kind of pink, and the vein would be bright red. The other issue is to avoid the accidental transection of veins or vessels, but mainly veins, and we could do that with having the microscope not too close to the field in order also to have a more peripheral view. The deep veins, their main importance is in the classification of Spelter-Martin for the AVMs, because these aid in the localization and mortality and morbidity associated with that specific AVM. So the superficial veins are very important, because usually the venous drainage is from one vein, superficial, so we cannot transect it. We can see the difference between vein and artery. And the occlusion, how we are occluding, is changing the color of the vein. So in a sense, we can say that the drainage vein is like the odometer or compass of how we are going in the resection of the AVM. The other issue is we will expect that as we are, let's say, sacrificing secondary veins, the needles becomes lesser in or smaller. But if we continue to see a engorged vein, primary vein, that would be maybe because there are some feeding arteries that are below or underneath the vein or the needles, so we haven't seen them, or because there is too much pressure, so we need to be seeing that what we are transecting is being transformed in a lesser pressure in the vessels around.